All right, everybody. I think we're good to go ahead and get started. Thank you for joining the March Grand Rounds presentation. Today, we are going to be hearing from Erica Hammond, one of our physical therapists. She's going to be discussing the Bionis vector system we recently got and how it's been going. So without further ado, here is Miss Erica Hammond.
Hello, all of you faceless names. I did something a little different. So I actually pre-recorded a presentation. So I'm going to show you that, and then I'll come back afterwards and we'll take questions. So just give me 1 minute and I will share it with you.
Today I'm going to be talking about unweighted gait training. Since some of us here today are not necessarily therapists, I wanted to talk about some terminology before we get too far into this. So the word gait means the way in which a person walks, or another word for that is to ambulate, or how they ambulate. Gait training is the process of assisting a patient to relearn or regain the ability to walk safely and or efficiently. A physical therapist has to look at the underlying reasons for that abnormal gait, and it could be muscle, bone, joint related. PTs have to understand how the muscles, bones, and joints respond to gravity on the body, and then provide possibly exercises or instruction to restore those aspects. And any of that could include strengthening, range of motion, working on balance, cognition, some visual, perceptual issues, maybe endurance, or even motor control. So when we think of traditional gait training, most people, when they think of physical therapy, think of gait training. And the first two pictures seem to come to mind are parallel bars and gait belts. Anybody knowing that's been around physical therapists, that's kind of what you think most when you think about a therapist. So those are kind of the most traditional, long-standing type of equipment you'll see, whether the patient's holding on to the bars for support or we're holding on to the patient and assisting them physically. And another form of gait training that's been around a long time is aquatic training. And that's been around a long time, but it's not as easy to find because there's not as many places that are able to afford having a pool, especially a larger size pool. In addition to using gait belts and parallel bars and things like that, you'll see us also maybe using things like walkers, canes, braces, or crutches to help the patient walk. So I'm going to show you now is a picture or a video of a traditional gait training example. And in this case, we've got two therapists working with this patient. So there's different reasons why we might have one or two people. We have, in this case, he's having difficulty holding his balance, moving his leg forward. So one person's also holding on to his hand, helping him hold the walker correctly. Another therapist is trying to help place his foot correctly. So we're doing all sorts of different movements using our bodies to kind of help facilitate the movement and help hold him. There are some problems with traditional therapist-assisted gait training. The main thing is, of course, patient injury due to a fall or almost a fall. So, and also leading along with that, that leads into therapist or staff injury. And trying to prevent a patient from falling, therapists and staff can also get injured. Another problem with traditional gait training is the issue of patient fear. And often patients are very hesitant. Of course, they're afraid of falling and they don't trust the therapist will be able to support them no matter how you explain to them that you can. So that fear is going to lead them to not want to go out of their comfort zone, not want to push themselves. And also the therapist being aware of safety issues, we may also not push the patient to their limit so that we don't have a fall. And all of that together creates an inability for us to maximize patient outcomes because of these combination of factors. So when we talk about body weight supported gait training, what that is a form of gait training in which the effects of gravity on the body are reduced or possibly removed by use of some sort of equipment. We can remove part of the body weight or completely, totally unweigh them. Usually when we are looking at using this with patients, we're using that in a patient whose muscles are too weak to lift the weight of their body up against gravity. So when we reduce the amount of weight on the patient, it allows them to attempt to lift themselves up and move forward in a more normal gait pattern. When a patient is struggling to even barely lift their body up, they're using all sorts of compensation patterns and recruiting lots of different muscles, which can lead to injury. And also we'll use this in patients who are having a lot of pain with weight bearing on their joints. So when we're talking about body weight supported gait training, there's been some increased research over the last several years regarding this. So a lot of the research is on patients who have had stroke or spinal cord injury. And what they found is that it's not just how far a patient walks with gait training, but how much they participate. And with body weight supported gait training, patients often have improved step symmetry. And also they found that when they compared walking over ground versus treadmill training, that walking over ground when they're training a patient had more carryover than treadmill training. So who needs unweighted gait training? The biggest two types of reasons why we would use this is that patient has a particular weakness that's affecting their gait, or they have poor balance. And that can come from a variety of reasons. The most common, I put them into two different categories. Orthopedic conditions, that would include any kind of lower limb fractures, pelvic fractures, spinal fractures, general weakness from just being inactive, or a lower limb amputation, or neuromuscular conditions, which could include brain injury, spinal cord injury, stroke, multiple sclerosis, muscular dystrophy, Parkinson's disease, and a whole host of others. So I'm going to go through some examples and pictures of some types of equipment that we can use to achieve this body weight supported type of gait training. The first of which is basically, you'll see this little device that's kind of hugging the patient around their trunk, and there's a little saddle harness that goes between their legs to help hold them up, and then the therapist can push a button, the machine elevates a little bit and takes weight off their body, and then the therapist can then sort of pull the patient around, and they can sort of help, the patient will take steps once you get enough weight off of their body. When we're talking about aquatic gait training, the water is what is unweighting the patient. So it's not necessarily something we're applying to them, it's just putting them in them takes the weight off their body, depending on how deep they go into the water. It's really good for patients who have severe osteoporosis or arthritis because it's low impact, and we might be able to use this as opposed to some of the other harnesses and vests and things when they have these conditions. It is difficult to measure exactly how much weight you are removing from a patient in the water. It's really hard to measure that. Of course, there's always a safety concern. If they're not falling on the ground, but they're falling underwater and they aren't able to swim, of course, that's going to be a safety issue. So some other issues that may prevent them from participating in aquatic gait training could include if a patient is incontinent or they have open wounds, any sort of open area on their body, tubes, colostomies, they're not safe to go into the water. Another device is called a Bionis Neck Step, and we're getting into some of the overhead harness systems where basically you type in a certain amount of poundage that you're looking for to take off the patient's body, and then it sort of wenches the patient up, and then this device is made to go over ground or over a treadmill. From personal experience, I can tell you that it's very difficult to maneuver over ground. It's very heavy and wide and bulky, and it does not turn well. So we usually end up using this sort of statically or maybe over a treadmill. And this is a light gait. This is a very similar type of device. Again, you can see there's a harness, they've got it over the treadmill, they're sort of walking in place. And over the last several years, there's been a lot of progress made as far as equipment and technology. So what's become more, one of the more exciting interventions that we have to offer is something called these overhead track systems with trolleys, as you can see in the picture there. Some of the more common brands you might hear about would be Zero G or SafeGait. And these type of devices are typically only at some of the larger hospital systems. There's not a very many in Michigan. There's one like at Mary Free Bed, there's one at Rehab Institute of Michigan, and a few other hospitals in the state. And another brand that is out there, which we currently have at our facility, is called the Bionis Vector Elite. Here now is a video by Bionis showing us exactly how the Vector Elite works.
Bionis has revolutionized rehab with the creation of the Vector system. With its unrivaled capabilities, Vector addresses the two largest concerns in the therapy gym, creating a safe environment for patients and therapists, and enhancing therapy outcomes. The Vector is a unique system consisting of a highly responsive robotic trolley on a ceiling-mounted rail, with the patient securely supported in a comfortable harness. The Vector tracks patient movements along the ground with unparalleled precision and provides continual dynamic unloading to prevent falls and advance therapy. Our state-of-the-art dynamic body weight support encourages natural movements and provides the freedom to learn and test balance reactions safely. With therapy space at a premium, Vector is ceiling-mounted, taking up no floor space. With dynamic body weight support, therapists select a percentage of the patient's body weight to unload. This percentage is based on the patient's ability and the activity. The Vector continuously monitors patient movement at 1,000 times per second, maintaining accurate unloading for any activity. Set a fall limit to keep patients safe and confident. Adjust the fall limit from 1 to 36 inches to fit any exercise, or completely disable it. The fall limit prevents falls, but doesn't restrict your activity selections. Predictable and dependable fall protection fosters trust, so patients work harder to get better faster. Confidence is critical. The Vector is remarkably simple to use. Just turn it on, choose your patient, and go. Settings can be adjusted on the fly, all from one single user-friendly screen. The versatility, the flexibility. Imagine the possibilities. This is the Vector system.
So next, I'm going to show you a series of videos with our own patients in our own facility. And first, what I wanted to show you was a comparison of gait training with traditional methods. And then I'm going to show you gait training with the same patient, same condition on the same day, put them in the harness and show you the difference and show you what we're able to do with the patient. We've got the walker, I've got the gait belt, I'm holding onto the patient. You can see he's got a lot of coordination issues. He's got a lot of ataxia, he's very unsteady. And you can see he's struggling to even hold the walker. Right there, he starts to lose the walker and he starts to lose his balance. So then I have to hold on tighter to him, obviously for safety reasons. So the next video that I'm going to show you is we have him in the harness, we have him in the machine, and we've unweighted him just about 30% of his body weight, and we've taken away the walker, we've taken away any physical assistance, and we're going to see how he does with walking. And so you can see he's able to take some steps, he's challenging himself, he does lose his balance, he does take a quote-unquote fall, but again, the device, we set it up so that it wouldn't let him completely touch the floor, it would stop him. So he was safe, and he knew that he was safe, and we didn't have to even put a hand on him to safely stop him. And then we did get him up off the ground, of course. The next video this is a video of him just trying to squat down to the floor. And you can see again, he loses his balance, but he's safe, the harness has him. He's sort of just hanging out, and the therapist didn't have to hurt themselves trying to hold him up or keep him from touching the floor. That's been very successful with him. Our next gentleman is a gentleman that has Parkinson's disease, and so we're going to show you how he does. with the harness. And again, with him, we're really only unweighting maybe seems to be about 20 to 30% body weight is all he needs to get him going. And usually he uses a walker and or a wheelchair. So for him to get up and be able to walk this far, this fast, with actually being upright as he is actually quite amazing, considering how he typically is not able to do those things. And then the next video showing him trying to do a little more advanced type of movement. So he's going to try to do some sort of sidestepping with the therapist. So he's trying, she got him started, and he's trying to take the steps. He loses his balance, but right there what you saw was him able to actually regain his balance. That trolley was adjusting to him and it was helping him, and he was able to actually react, respond, and keep on walking, versus without that, the therapist would have had to stop, hold on to him, they would have stopped, he wouldn't have had that opportunity to even try. And this next video here is just a video of him doing some of his exercises, just showing how it moves with him, and he's nice and safe, and you know, he can go and reach as far as he can reach. And he's actually working on a therapy intervention called LSVT Big, which one of our other therapists, Bavia, described to us a couple of months ago. So some of the contraindications or reasons why we would not use this on a patient are, we can't use it over people weighing more than 500 pounds. We can't use it on anyone that has unstable fractures or the halo neck supports. Anyone who is medically unstable, so that could mean uncontrolled diabetes or blood pressure, severe osteoporosis or seizures. Then there's some precautions. These might preclude a patient from being able to use it, but not necessarily. It's kind of a case-by-case basis on a patient. So sometimes if a patient is very anxious, confused, or even combative, it's not going to be real successful. However, if you can get through the harness, taking the harness, putting it on and taking it off, if a patient gets combative while they're in the harness, the therapist can just step away and not get in the midst of the patient's hitting or kicking or whatever it is they're going to do. If a patient has PEG tubes or colostomy bags or any type of implanted pumps or devices, depending on the placement of it, we might be able to work the harness around it. We just don't want to be pushing in the wrong ways and irritating those types of things with the actual harness, because it is fairly tight. Pregnancy, it would depend on at what stage of pregnancy the patient was in, or other healing rib fractures, surgical sites on the torso, depending on how far out they are from their healing process, may or may not allow them to participate. So the nice thing about the Bionis vector system is that it can be combined with other evidence-based treatments. It could include exoskeletons, which are sort of robotic limbs, virtual reality, functional electrical stimulation. We can kind of pair them all together, and we're using multiple different types of evidence-based treatments at one time. So at Insight, we can offer pretty much all of these things. At Insight, we have a variety of safe, evidence-based, unweighted, and traditional gait training options. We do have the Bionis Vector Elite that we've been discussing. We also have the Biodex Next Step and the Rift and Tram, and we have a pool so we can do aquatic gait training. So we can pretty much handle whatever the patient needs and provide whatever type of gait training they need to be successful.
Okay. So if anybody has any questions, feel free to ask. Oh, and I should say, before I go further, I need to give credit to my husband who spent a lot of time helping me edit that. I do not know how to do any of that. So he was very helpful and spent a lot of time helping me edit that together.
Yes, I enjoyed your presentation. That was very well put together. At this time, I have given everyone the ability to unmute or type in the chat if you have a question. But I think I'll start with one. What would you say are the most common challenges you see when patients start with the Bionis vector for like the first time? Is it just?
I think getting them fit in it, in the harness, getting all the setup, figuring out how much weight, what the settings should be, getting them comfortable with it. We're still getting comfortable with it because it's still relatively new to us. So I think that's just kind of getting it set to where it will help them. And then once that's set up, it seems to go pretty well.
Okay. Anybody else out there with a question? Last call for questions. Anybody out there?
Well, I'm sure if anybody has any other questions they come up with later, they know how to get a hold of me.
Sure, absolutely. Looks like Chloe has a question. What is a good progress marker in terms of the vector?
What is a progress marker? Is that what you said? So it does measure for us. It actually, the software keeps measures of how far the patient walked, how much assistance or how much weight they were needing. It does measure falls, like for what would have been a fall. It measures how many falls the patient has had. It'll tell you how many falls get prevented. So over time, you can see either the patient's walking farther, they're needing less assistance, they're having fewer falls or close calls. So really, if that number is going down, that the falls prevented is 0, that's really good news. So those would be some of the reasons or ways we would look at that.
Wow, so a lot of technology incorporated into it, I see.
Yeah.
I don't have a question, but I did want to say that was a really awesome presentation. I've personally worked with cancer patients before, not in a clinical setting, but this type of therapy I've always noticed is really, it's just incredible how much of a difference it makes. And I feel like it almost encourages the therapist as well, because the stress of having to carry the patient, or especially when they're larger, it just makes it a lot easier to maneuver and a lot easier to help both the therapist and the patient when you have something like this to work with.
Yeah.
So thank you for that presentation.
Okay. Well, if no one has any questions, then that does conclude this month's Grand Rounds presentation. Thank you again, Erica, for the video. That was very, like I said, well put together.
Thank you.
Don't forget, everybody, to follow us on all our social media platforms. And thank you again, Erica. I hope everyone has a good rest of their day.
Thank you.
Thank you.
Yep. Bye, everybody.